Hi, my name is Jim Watson. I'm a physical therapist and I manage this physical therapy clinic in Novi. So I get this question all the time. And the big foundation with physical therapy is we always try to stabilize an area that's injured. Anytime the body feels pain, swelling, instability, anything that's just not quite right, it's going to always want to tense up to try to protect itself. And the trouble with that is it just creates more compression on the injured area, and it also creates some pain with the spasm itself. So the first part is we always want to try to get the body moving and loose and try to break down some of the body's protection, and then we start to build up some of the strength and stability so that the body doesn't feel like it has to protect itself. The trouble is, in order to build strength, that takes some time in order to reach a certain threshold to where the body feels comfortable enough to where it doesn't have to protect itself. With PT, we obviously want to get you feeling better, moving better, and all these kind of things, but we also want to try to get to the root cause of the problem. And it takes a little time to kind of peel back the layers of that in order to kind of get you feeling better first, and then start to get to stabilize the joint, to mobilize the area, to correct alignment, to do all the other things that might be an underlying cause to why you're feeling the way that you do. Yes, the home exercises are very important. So I kind of look at physical therapy, rehab, and recovery in 3 phases. The first phase is you have to get moving and loose. The second phase is you figure out whatever the limitations are and you build them up. And then the third phase is to try to put them all together and try to get the body working together in order to prevent further injury. And the more you do your home program, the more you'll be able to speed through those processes and those phases, and the better outcomes you're going to get overall. Well, obviously I'm a little biased with what physical therapy that you choose to go to. I really appreciate the system that we have here. I work hand in hand with all of our doctors. At any given day, I text message, I call, talk face-to-face with all of the physicians and PAs over there. If there's anything that is going that I don't expect, somebody a little bit slower than expect, I can talk directly to them and make sure that there isn't anything wrong or it was something that was expected in the first place. And on the flip side, if anybody is doing really well and I want to try to continue to progress them, even past how good they're doing, I can always go to the doc and figure out what I can do and what I can't do in order to keep them ahead of schedule. Typically, every clinic has its own area that they specialize in, whether it's orthopedics, neurologic, pediatrics, anything like that. So whatever your area of injury is, I would do some research to figure out what clinic in your area specializes in those areas. So in order to go directly to a physical therapist, it's something called direct access, which is fairly new in Michigan. A physical therapist can legally treat you, they can diagnose and treat. The only problem currently is it doesn't mean that it's going to get reimbursed by the insurance company. It's always best to try to get a physical therapy prescription first in order to guarantee that you can get some of the benefits of what your insurance covers for you. So physical therapy is a research-based treatment method. We look into doing diagnosing, treating, preventing for the future. We use all kinds of different techniques such as different exercise programs, different manual techniques, and different modalities. Just trying to get you as good as we can, as fast as we possibly can. Thank you so much for listening. If you have any questions, please visit our website at www.thecoreinstitute.com.